If you're using any compound, be it alcohol, be it a sleeping pill, which are, sleeping pills, by the way, come with deathly consequences and higher risk of cancer, or you're using, markedly increased risk.
Is that because there's something directly the sleeping pills are doing, or because the way it affects your, what does it do to your sleep, sleeping pills? A lot of people take Ambien.
So in the past month, 10 million Americans have swallowed some kind of sleeping aid, either prescription or over the counter, monumental amounts.
Yeah.
You know, I often joke that I think, and it's not really a joking topic, but you know, it took George Lucas about 40 years to amass $4 billion in profit from the Star Wars franchise. It took Ambien less than 20 months to amass $4 billion in profit. That tells me everything about the insufficiency of sleep and the desperate need for sleep in this modern 21st century era. But the problem is, Ambien isn't part of that same class of drugs that alcohol is. It's what we call a sedative hypnotic. It works on the same receptor, which is the GABA receptor. Now, it tickles the GABA receptor in a different way to that which alcohol does. But what we found is that sleeping pills, and I won't name any names, but including the one that you described, they are sedating the brain. You're not going into naturalistic sleep. If I look at the electrical signature of your sleep when you're on a sleeping pill versus natural sleep, it's not the same. Secondly, what we found is that those sleeping pills can often come with a grogginess in the morning and some forgetfulness. Third, what we've found is that in animal models, and this is work that was done by Marcus Frank, who's a wonderful friend and colleague, he was looking at how the brain rewires itself during sleep, and the brain does, particularly during the development. And he has a model in animals where if you sort of put a patch on one of the eyes when the visual cortex is developing, the visual cortex shifts over to developing more wiring to the eye that remains open. And it's called the monocular deprivation paradigm of brain plasticity, and it's a very well worked out model of brain plasticity. If you give those animals some exposure, once you've patched the eye to the eye that remains, you drive learning and plasticity, and then you allow it to sleep. Sleep will strengthen the synaptic connections that have been made during the day by about 100%.
Wow. So
sleep is almost as powerful as experience during the day. That's how sort of strong and powerful it is. But what he then did was a study where he dosed those animals with Ambien. Now, it turns out that those animals slept even longer, if you look at the data, than the animals who weren't dosed on Ambien. And the prediction would be, surely they would have as much, if not more, of that wonderful brain plasticity. The opposite was true. Ambien-induced sleep resulted in a 50% unwiring of the connections that have been made during the day, rather than potentiating them. And that frightens me, because if you look at the prescription age of sleeping medications over the past decade, it's coming down and down. I don't know how long it's going to be before prescription medication comes into a pediatric realm, and if those data hold up, it makes me worried. So I'm coming off topic a little bit, but we know that sleeping pills are associated with a markedly higher risk of death, as well as cancer, as well as your susceptibility to infection, particularly pneumonia. But returning to alcohol, it is definitely one of the most, I think, misunderstood drugs. But what I was saying regarding THC, alcohol, sleeping pills, if you are using anything to help you sleep, I think you have to ask yourself, are you just really treating, you know, an open wound and not really actually trying to stitch it up? Because what that is simply doing is masking a problem that you're not dealing with. You know, why is it that, and many of, and this is not a criticism, and I'm sorry if my voice sounds like that, and it's not, you know, I'm so sympathetic to people who have sleep problems. We see them all of the time here. But you have to ask why. Why is it that you're struggling with sleep? Is it because you're of a certain chronotype and you don't understand your chronotype, and you're sleeping at the wrong phase of the 24-hour period and it's masquerading as insomnia? Or do you have too much anxiety in your life and you're blunting that anxiety with things like alcohol or THC or sleeping pills, you know, you're just kicking the can down the road. You're just hitting the mute button, but the movie is still playing of damage. Whatever is causing that sleep disruption, you know, is still there. You're just sedating your brain and trying to mask it. So I think people who are using those things, if they're having sleep difficulties, you should ask yourself, could I examine my life and really think more about what it is that is preventing me from sleeping? What's good is that you don't have to turn to any of those, because there is a non-pharmacological treatment that is just as effective as sleeping pills in the short term. It is completely safe, and it is more efficacious in the long term. And it's called cognitive behavioral therapy for insomnia, or CBTI. Based on its efficacious nature, and they've done lots of randomized clinical control trials, it is just as powerful as sleeping pills in the short term. But when you start working with your therapist, and you work with a therapist for several sessions across several weeks, it doesn't, when you stop working with that therapist, you don't go back to the bad sleep that you have. You continue on with your good sleep. Unlike sleeping pills, which is when you stop them, you have what we call rebound insomnia, which is that you tend to go back to the bad sleep that you were having, if not worse sleep that you were having before you started taking sleeping pills. And the dangers around sleeping pills and their lack of true benefit above and beyond placebo, which is, if you look at these meta-analyses, in 2015 or 16, the American College of Physicians made a landmark recommendation. They said that sleeping pills must no longer be the first-line recommended treatment for insomnia. It must be cognitive behavioral therapy for insomnia, because of both the deleterious, deathly, and carcinogenic consequences or association with, I shouldn't say cause, because we don't yet know cause, but certainly they are associated with higher mortality risk and higher cancer rates. CBTI, this cognitive behavioral therapy, must be the first-line recommendation treatment. The problem is most doctors don't know about it, because most doctors get a less than 2 hours of sleep education during the medical curriculum.